Hi, I'm Dr. Craig Chappell with In2it Medical, here to answer a couple questions about meniscal injuries. The questions being, what do you typically see in meniscal tears? Well, meniscal tears present in lots of different ways. They can present acutely, they can present chronically, but it usually presents with knee pain, knee swelling, and dysfunction, and sometimes locking and catching. And so, as far as best treatment options, I'm a regenerative medicine doc. I'm a non-surgical orthopedist. So people come to me with questions concerning what are my non-surgical options. Well, first of all, we have to rule out your surgical options. So for instance, if you come with locking, catching, or popping, and mechanical inability to move your knee, you more than likely have a meniscal tear, but it's going to require surgery in order to resolve it in most instances. It also has a lot to do with your age. When you start approaching 60 years old and even over 50 years old, meniscal tears are not the same as they would be in a 20-year-old that twists his knee and ends up with getting a surgery with some torn ligaments and stuff. The older we get, we also experience degenerative changes in the meniscus. Degenerative meniscal tears are not an indication for surgery. So if you have a degenerative meniscal tear on MRI or other imaging, you have more options, and some of those options would be regenerative injections, which work fairly well for resolution of pain associated with meniscal injury or degenerative meniscus changes. It also depends where the tear is at in the meniscus and at what age as to how fixable it will be through surgery or through regenerative injections. Oftentimes we use platelet-rich plasma or even a bone marrow aspirate concentration solution referred to as stem cells to treat these meniscal dysfunctions. Sometimes the meniscus may be torn in the presence of instability, and the ligaments that anchor the meniscus to the knee are the problem, and that responds well to regenerative injections, as surgical options for that problem aren't really viable and not really performed. So it really depends. I wish I could tell you specifically, like, hey, this meniscal problem needs that. We actually have to get an MRI, determine your age, where you're at in life, and see whether or not regenerative injections would be best. Oftentimes, surgical options are the best thing for it, even though people come and say, I want anything but surgery. Sometimes that's the best option. So it really depends on imaging, where you're at in life, and what your goals are.